Local mother says medical marijuana is showing a lot of promise in helping her autistic son with anxiety attacks and panic disorders. She says he's been taking a low dose of THC for several months now, and his life has changed dramatically for the better. Spectrum News 9's Lori Davison is joining us live now at 10:15 in our Hillsborough County Bureau with her story. Hi, Lori.
Well, hi, Veronica. That's right. It has been a long road for the Mulry family. Gabriel's mom says that he was living in a nightmare, almost catatonic at times. She calls the state's approval of medical marijuana their answer. 12-year-old Gabriel is a happy, talkative child who loves playing in the family pool. Diagnosed with autism at 16 months, his mom, Jennifer Mulry, says while he had some challenges, things were good. But as he got older, that started to change. He struggled with a severe anxiety disorder similar to PTSD.
He seemed terrified most of his waking hours.
Gabriel's pediatrician, Dr. David Berger, tried all sorts of medications, but he just kept getting worse.
So we really kind of got to a point where we're like, well, we have to try something else.
Initially, that something else was CBD, the non-euphoric form of medical cannabis. Dr. Berger says while most children with similar symptoms respond well, Gabriel turned out to be the exception.
We start the CBD and he's tanking on the CBD.
With few alternatives, they decided to add THC. While both are cannabinoids, the psychoactive effects of THC can make it less desirable.
And there is a concern about the long-term effects of THC on cognitive function and memory, no doubt. Then again, there are those same concerns when the medications that are used, a lot of them as well. So again, it comes back to, for any one individual, what's the benefit versus the alternative versus the risk.
They started Gabriel on a low dose, and almost immediately, Jennifer says he started to improve.
That's when we started to see our kid come back.
She says Gabriel's panic attacks and anxiety are under control, and they haven't seen any adverse effects.
If this is as good as it gets for us, then we're living a pretty great life.
A life she says Gabriel now enjoys rather than fears. And Jennifer says that she's not really sure what her son's future holds, but she says that she's always wanted three things for him: health, happiness, and to know that he's loved. And she says right now, he has all three. Live in the Hillsborough Bureau, Lori Davison, Spectrum Bay News 9.
Very interesting. Thank you, Lori. And while autism in and of itself is not a qualifying condition for medical marijuana in many states, there is a push underway to change that. A study is planned about the possible benefits at Children's Hospital of Philadelphia, and results could be out by the end of the year.